Hello, my name is Shivani Puri. I'm a fourth year student doctor at the university. Please could I check your full name and date of birth? Could I check that with your hospital wristband, please? Okay, and what would you like to be called? Lovely to meet you. So I've been asked to do an ophthalmoscopy examination on you today. Have you had this done before? What that would involve is I'll be having a general look at both of your eyes. From here, I'll be using a device known as an ophthalmoscope to have a look at some of the deeper structures within your eyes. This will have a bright light, so if at any point you do feel uncomfortable and want me to stop, do let me know. I will require the lights to be dim for part of this examination, and as I will be in close proximity with you, there will be a chaperone in the room just to make sure you're as comfortable as possible. Are you happy for me to proceed? Do you have any allergies? Are you in any pain? Have you noticed any changes in your vision? Okay, so I'm just going to clean my equipment and then I'll be back with you. So I'm going to be speaking to my chaperone as I do this exam. Is that okay with you? I'm just going to start off by generally inspecting both of the eyes, looking for any swellings of the eyelids, any asymmetry, signs of strabismus, having a look at the pupil shape, the iris and the sclera. From here, I've already cleaned my ophthalmoscope, so I'm going to set the dial to 0, check for red reflex in both of the eyes. At this point, I would want to dim the light. I'd then get the patient to focus at a certain point in the distance. So I'm going to shine the light in your eye, having a look at the anterior part of the eye, such as the iris, cornea, the iris and the lens. And this would be on a positive green number setting, so plus 12 or 15. Then I would change it back to 0 for the deeper structures and go to maybe -2 or -4, locate a blood vessel. I would then track back towards the optic disc, having a look at the shape, if there's any optic cupping and signs of papilledema, having a look at the blood vessels to see if there's any flame hemorrhages, cotton wool spots, hard exudates. You'd look at the superior nasal, inferior nasal, you'd have a general look at the retina, move towards the fovea and the macula. In order to inspect the fovea, you would ask the patient to move their gaze towards the light just for 1 second, which may be uncomfortable, and then they can look away. You're looking for a flicker of light. And then you thank the patient for their time. This brightness. Oh, I forgot to say, you reduce the brightness of the light before you examine the macula so that it's not uncomfortable for the patient.